So what are the issues with this radiographic sacroilitis? Because now we know that if you have a radiographic sacroilitis, you have some clinical feature, this is ankylosing spondylitis. But then people have realized, you take this case, there is a 30-year-old male having inflammatory back pain for 6 months. The X-ray is normal. The bilateral sacroiliac joints are normal. But when people have started doing MRIs, because MRIs came around 2000, just 3-4 years. Well, 1996, 97 MRI came. And then when people have done, they have seen that many people which they were discarding that this is not ankylosing spondylitis. When they have done a MRI picked up very nice bone marrow edema. So they told me then we are missing many cases who are actually having this disease, but X-ray was not picking. So issues is there a large intra and inter-observer variability when you interpret X-rays. Grade 4 is okay, there will be no mistake. Grade 0 is okay, but the grade 2, grade 3, because grade 2, grade 3, your classification criteria for ankylosing spondylitis will differ. But I have personally experienced, and many times in rounds my teacher will tell that this is grade 3, then he will be thinking, "Arey, sach mein hai kya?" So real iliac joint X-rays are very, very difficult to read. You will give it to a radiologist, they will tell something else. You give it to a clinician, they will tell something. So there is large inter and inter-observer variability, particularly in grade 1 and grade 2. MRI detect early sacroiliitis, that is clear. And some people, like Sarah told, will never develop sacroiliitis, although they have a spondyloarthritis, late into the disease. So how will you pick by only doing a X-ray and this thing? So that's why we were missing many spondyloarthritis previously. 2009, assessment of ankylosing spondylitis International Society, they came up with this ASAS criteria, 2009.